Two complications unique to facelift surgery that are kind of on opposite sides of the spectrum: hematoma and ischemia. During facelift surgery, we as surgeons lift all this tissue away from its underlying structure. That's what allows us to lift and redrape things appropriately. Now, one risk when we lift all of this up and lay it back down is that if there's any small amount of bleeding under the skin that exceeds the capacity of your body's ability to deal with it, it forms a hematoma. A hematoma is a blood collection or a blood pocket under the skin. Statistically, hematoma is one of the highest risks complication-wise after facelift surgery. Think of it as too much bleeding. Ischemia is on the other end of the spectrum and is also a feared complication of facelifting surgery. Ischemia is when there's not enough blood flow to the most distal parts of the flap or of the tissue that's been lifted away from its blood supply. Now, the important thing is, one, discussing the risks of these with your surgeon before surgery. The other thing is for your surgeon to catch these early and treat them appropriately. It's important to see facelift patients back fairly frequently during the first few days of surgery. If somebody has a hematoma or ischemia, it's typically recognized at post-op day 1, meaning the day after surgery. For hematoma, we basically evacuate the blood and then try to prevent it from reaccumulating. Depending on how large the hematoma is, sometimes we're able to needle aspirate it, meaning pull it out with a needle. Other times it may be better, more efficient to go back to the operating room to open the little incision next to the hematoma and then to suck out the blood. And then afterwards, your surgeon may put on a netting suture to quilt the skin down to the underlying tissue. They may apply a pressure dressing that is really compressive. And then most of the time, we as surgeons will put patients on an antibiotic prophylactically if there's been a hematoma, because blood is kind of an area where bacteria wants to grow, wants to breed. So if there's any little amount of bacteria, it has a high likelihood of getting infected. Now, ischemia, on the other hand, I have another video on. Basically, you do everything you can to reestablish the blood flow. Special ointments, extra oxygen therapy, etc.